This module is our module on design and planning. And today we have a lot of different design plans. These are called blueprints, and they're actually designs of how we build a house. And I do think that this kind of design helps us also consider how we build an effective public health or population health program. Now, sometimes our public health or population health programs are also called logic models. Yes, logic models is kind of a very difficult phrase, but honestly, all it means is that we have a plan. We have a plan of action. And that plan is usually designed by a team of experts and a team of people that know what the issues are. We have some plans today that actually help us build a house. These plans tell us how the house is designed, the parts of the house such as the kitchen, the framing, the drywall, even some aspects related to nail work. From the general to the specific, these blueprints help the team, the crew, the specialists, the people that are contracted to do particular parts of the building know what their jobs are. Eventually, the house will be done and people will move in. Similar to a health promotion plan, a plan helps us decide what kind of building or what kind of design work or what kind of outcome we want to have at the end of our work. As contractors design their plans for a house, I understand that they have to take into account several elements that the health promotion team has to account for too. For example, to build a house, you have to have the location fit with the house. A survey team will come out, look at the geography, the terrain, and make sure that the planned house is a fit. For a health promotion team, the same thing applies. A survey team that does data collection, finding out what the health issues are and who's involved, will inform the actual plan. Another factor that influences the blueprint of a house is the money. How much money does that family, does that person have to actually support the building of their dream house? Same issue applies with health promotion planning. Do we have the resources? Where are we going to get them? Not only financial, but time. Finally, what is the outcome of the health plan? For the outcome of a blueprint for a house, it is a home. For a family, for people, for professionals, for everyone to feel comfortable in and to have a quality of life in. Very similar to that home, we want our health plans to provide an improved quality of life. A plan can be a long-term plan, could be up to 5 to 10 years for a public health issue, which is usually very complex, time-consuming, and requires many experts and people to be involved. A house plan may take a fairly short period of time to complete, 3 months, 4 months, but even in that period of time, there are issues that affect the plan. Weather, materials, work crews, how successful the plan was actually written at the first, all affect the timeliness and the eventual house that will be built. In health promotion, the same issues apply. Maybe the team that designed the public health plan have an outcome in mind that's beneficial to everyone, but along the way, the plan has to be modified. Change orders have to be applied. Issues related to, are there staff available to help with the health plan? Are there enough resources? Does the health issue change? Has it improved without the implementation of the plan? Those factors apply to our planning and how we're learning about that through the module that you're going to be viewing and the exercises you're going to be involved with. One of the exercises that we're going to ask you to do is actually designing your plan based upon a public health approach. What are the major issues in your community? What does data tell us about those issues? Are they prevalent? Do you have enough resources to actually address those? And then also, what are the evidence-based programs that have been implemented before to affect or to change or to improve that health issue? And finally, in building a house, the blueprints are kept for a number of years because changes to that house may have to be made. Maybe an expansion has to be added on. Or possibly we just want to know, how did that plan really help build that house, because we want to have a similar house in the other part of town. As public health plans are built, they have to be kept, evaluated, and we want to sustain our work. So again, periodically, the experts who help build that health plan will pull that plan out, check to see if it's still accurate, check to see if it's sustainable, or maybe they'd like to use that plan in another area, or another issue, or another public health concern. And I invite you now, let's begin planning. Let's look at our long-term outcome. Let's start building our frames, working across all of our expertise to get to an outcome that actually improves the health of people in our community.